Hello, everyone. I'm Marcia Mott, the Health Promotions Coordinator for UF Health. Welcome to UF Health Wellness University webinar. We'll be talking about the COVID vaccine for children. Tonight, we're very lucky to have two incredible speakers to provide us the latest information and answer your questions. Our first speaker is Dr. Sonja Rasmussen. She's a pediatrician, clinical geneticist, and also serves as the director of UF's Precision Health Program. She recently joined UF after 20 years at the CDC in Atlanta. While at the CDC, she served as the deputy director of the Influenza Coordination Unit, which was responsible for the CDC's pandemic influenza preparedness. She received a master's degree in medical genetics from the University of Wisconsin and graduated medical school at the University of Florida. Our second speaker tonight is Dr. Molly Posa. Dr. Posa received her undergraduate degree in biology from Franklin and Marshall College in Pennsylvania and graduated medical school at the University of Florida. In 2012, she completed her pediatric residency at UF Health and immediately began her career as a pediatrician at UF Health. She sees pediatric patients at the UF Health pediatric practice located in the town of Tioga. She enjoys spending time with her family and cheering on the Gators. We're very fortunate to have these two outstanding speakers today who are experts in their fields and caring for our youngest patients here at UF Health. We welcome your questions tonight and we want to give you a chance to get answers. There's no judgments, so please feel free and ask your questions. When you have a question, you can submit a written question anytime using the Q&A button at the bottom of your screen. At the end of the presentation, I'll read the questions which were submitted. This webinar is being recorded and I'll send out a link to the recording within a few days. Dr. Rasmussen, I'm going to go ahead and turn it over to you now. Thank you.
Great, thank you so much. I'm trying to get my slides up. Can you see them?
Yep, we see them just fine. You just want to make them full screen.
Yep. All right, great. Thank you so much for joining us tonight to talk about COVID-19 vaccines for children. And it's my pleasure to talk to you about this. I'm going to give you a little bit of background about COVID-19 and especially COVID-19 in kids, because we're really looking at weighing those benefits of getting the COVID-19 vaccine against the potential risks. So first of all, where are we at with COVID-19 now? And so I wanted to include, these are the number of cases. And here you can see from January 2020 till November 23rd, you can see that we've had several waves of COVID-19 and it doesn't seem like it's stopping. So this is in the United States. There's that first wave when we all shut down, second wave, the third big wave that occurred at the holidays last year. And then the fourth wave that occurred this past summer, fall, depending on if you were in Florida or if you were in other areas of the country. And you can see that it came down and then we're starting to see our numbers head back up nationally again. So while we're talking about what's happening with COVID-19, I wanted to mention the Omicron variant because I know that so many of you heard about this on the news, and it's funny, this is changing, this information about Omicron is changing by the minute. It was first identified in Southern Africa and South Africa and Botswana, and now as many as 90% of the cases in South Africa are due to this Omicron variant. Now, what does the Omicron variant mean? Well, viruses change all the time. And for example, that's why we get a flu vaccine every year, because there's different, the flu virus has changed between one year and the next, and so we need to have a new flu vaccine. Well, we're seeing those same sort of changes with the COVID virus. We saw that there was initially an alpha, there was the original, then there was an alpha, a beta. Recently, you've heard about the Delta variant that really caused a lot of cases, and this is the most recent variant, Omicron. And we don't really know where it emerged. It was first seen in South Africa, but we don't know where it emerged first. What we're seeing is that now that people are looking for it, though, it's in a lot of different places. You can see this, these were the first cases. You can see how many, all these stars around the globe, including in Canada. So I think even though we say right now there's no known cases in the United States, I think it's likely that there are cases in the United States that we don't know about them yet. I expect we'll be hearing about cases in the United States soon. So it's been found in, I put more than 20 because this morning it was 22, later in the day it was 23, it may be even higher than that now. So what is why is everybody getting so excited about this Omicron variant? Well, when you look at the genetics of it, when you look at those letters that are put together that make its genetic material, there are a lot of changes. It's the most changed variant that we've seen. There's supposed to be more than 30 mutations in that virus, but we don't know right now what those changes mean. We know that it appears to be spreading a lot, and we know that it seems to be taking over in South Africa. But we don't know how transmissible it is. We don't know what the severity of disease that it's causing. And right now, we don't know if those mutations are going to make changes in the way that our monoclonal antibodies, some of the treatments that work, or in the ways that the vaccines work. We expect the vaccines will still work, but they may not be as highly effective as what we've been seeing otherwise. So now to talk about COVID-19 in children. And I know one of the things we've heard from early on is, well, COVID-19 isn't as severe in kids. Well, that's true. It's not as severe in kids as it is in someone that's 65 or older. It doesn't mean that just because there's lower risk in kids, it doesn't mean that there's no risk in kids. And so I want to talk about some of the things that we worry about in kids. So first of all, we weren't really seeing very many cases in kids. The dark blue is the cases in children. The light blue is the cases in adults. Early on, of course, we were staying home. Kids weren't going to school. They were really protected. And so there were very few cases in kids. Then you can see in more recent times, the percent of cases in kids has gone up. And the most recent week that we have data on from November 18th, it was about a quarter of people who got COVID-19 that week were children. And that's because many of the adults are getting vaccinated and so are protected. And so we're seeing more kids that are infected than what we've seen in the past. How severely are kids affected? Well, kids don't die as often of COVID-19 as adults. Young kids don't die of anything as much as older people. And that's the good news. The good news is that we're not seeing a lot of deaths, but we are seeing some deaths. And you can see in this 5 to 11 year age category that we're talking about the vaccine primarily tonight, there have been, through October 16th, there were almost 100 deaths, 94 COVID-19 deaths in the United States. And that doesn't count all the hospitalizations and intensive care unit admissions that we've seen. The other thing to note, as I said, that COVID, kids in that age category, fortunately, are pretty healthy, and so they don't die of very many things. But when we look at the top 10 causes of death, these last 2 months in August and September in kids ages 5 to 14, you see here, it was the 6th leading cause of death. So it's something that is really damaging children, just like what we see in adults, just not as high rate. So what do we know? How does COVID-19 affect children 5 to 11 years of age? We know that more than 1.9 million children 5 to 11 years have been infected. And some of those kids have had mild illness, but some of them have had more severe illness. So more than 8,000 have been hospitalized as of mid-October. And I hear a lot of people saying, well, those kids had underlying conditions, right? And a lot of those kids did have obesity, asthma, heart disease, other underlying conditions, but 30% didn't. 30% were healthy kids before they got COVID. And of those kids that were hospitalized, about a third of them needed intensive care unit care. And when a child needs intensive care unit care, they need to go to the ICU. That is really severe illness. We also, and I know most of you probably heard about this multi-system inflammatory syndrome in children. It's something that is seen usually about 2 to 4 weeks after children have COVID. Sometimes they could have very mild COVID in the first amount of time, and then they get this MIS-C. The most common age to get MIS-C, which is a very severe illness, most of those kids end up in the intensive care unit, is in that 5 to 11-year-old age category. So we really want to protect kids from that. That is really a serious illness. The other thing is we've all heard about long haulers or long COVID or post-acute syndrome from COVID that means people have long-term effects, sometimes 6 months or even a year after having COVID, where they have things like trouble breathing, their heart beating fast, and brain fog and so on. And that does occur in kids. The studies that have been done show the numbers all vary widely depending on the study, but it looks like about 7 to 8% of kids do get long COVID. The other thing is that kids can spread the virus to their family members and to their teachers and fellow students. So what about the COVID-19 vaccine for children 5 to 11 years? And you know that very recently, on November 3rd, was when the final emergency use authorization was given and the approval by the CDC. So this was something that went through several steps, studies done by the company, by Pfizer, then going to the FDA. The FDA had an external advisory committee that reviewed the data. Then going to the CDC, they had an external advisory committee that reviewed those data too. So experts throughout the country that reviewed the data, and they gave the final approval on November 3rd. And of course, many kids started getting vaccines right away after that. So what were the studies that were done? Well, they did a randomized controlled trial. So kids who got the vaccine, got a shot, didn't know if they'd gotten a shot or whether they got a placebo, whether they got just a saltwater shot. And it was 2 to 1. They knew a lot of parents wanted their kids to get the vaccine, and so they gave 2 doses. 2 kids got the vaccine compared to 1 that got the placebo. What they found is that the vaccine efficacy against symptomatic lab-confirmed COVID-19 was almost 91%. And here you can see this graph. Here you can see the kids that got the vaccine, the very small numbers of cases of COVID-19 versus kids that got the placebo. And here you can see the ones that got the placebo who didn't get the vaccine had lots of cases, about 19 in that number of cases. And this was 3 in the ones that got the vaccine. So you can see that it clearly was protective. So what are the other benefits of vaccinating children? Well, we know that it will help to bring our pandemic to an end. I think the main reason to get a child vaccinated is to protect the child, but it also helps overall to decrease numbers in our community. It helps to decrease the chance of emergence of new variants, and we need to vaccinate here and we need to vaccinate in other countries too, because otherwise we're going to continue to see Omicron and who knows what the next one's going to be. Fewer school closures. We know that kids have really had a rough time with being out of school, lots of kids being quarantined, and then the other effects of the pandemic, not directly to COVID-19, but effects of the pandemic with issues related to mental or emotional health because of having to be out of school, the widening of existing educational gaps, decreased physical activity. There's been studies that have shown that kids, in addition to a lot of us, have gained some weight during this pandemic, have had an increased body mass index. More kids are overweight or obese than were before. And we know there's decreased routine medical care, decreased other childhood immunizations, which are really important. And many of you probably seen the headlines of how many kids have lost a parent or caregiver due to COVID. So the Pfizer vaccine is what's called an mRNA vaccine. And so just to help understand how that works, this is a slide that was put together by the NIH. So the mRNA is really a message. It's like a recipe for our cells to make a piece of the virus. So not making the whole virus, just a little tiny piece of the virus, that one of those spikes that is on the outside of the virus. That is something then that it comes into the muscle cell. The mRNA is injected into the muscle. It has some kind of a fatty particle around it, a lipid particle around it. Both of those break down in the next 3 to 4 days. And the recipe tells our cells how to make the spike protein. Our cells make that spike protein and our immune system responds to it. So that immune response is what what really a vaccine is doing. It's making sure that then next time when we see something that has that spike protein on it, that we're ready to go, we're prepared to respond to that virus. And that means that people sometimes can still get virus in their nose. You've heard a lot about that, but typically won't get severely ill, substantially decreases the risk of hospitalization and severe illness from COVID-19. So what kinds of side effects have been seen? And keep in mind that this was in a study where parents and kids didn't know if they'd gotten the vaccine or if they'd gotten a placebo. What was seen is that people had some side effects. The most common ones were ones at the local site, at the injection site: pain, redness, and swelling. There were some that were the whole body. Kids were fatigued, very tired, headache, muscle pain, chills, fever, and nausea. But those were not very frequent. The pain at the injection site, fatigue, and headache were the most common side effects that were seen. And typically they resolved on their own within 1 to 2 days. And side effects were more common after the second dose of the vaccine than the first. So that's very similar to what's been seen in adults. What about serious adverse reactions? There were no serious adverse reactions in those 3,000 kids that received the vaccine in the clinical trial. There were no cases of myocarditis. I'm going to talk a little bit specifically about myocarditis. That's the heart inflammation that you probably heard about on the news that has been seen in some of the older kids. None of that was seen in the kids in that clinical trial. And there were no deaths. And I want to repeat that because there's been a lot of discussion about the vaccine causing deaths. I have not been able to find any reports of any deaths in children from the COVID-19 vaccine. So what about the risk of myocarditis? I know you've heard about this on the news. Myocarditis is inflammation of the heart muscle, and it occurs most often after a viral infection. Actually, it's not something that we usually think about related to a vaccine. It's something we think about when we see a child with myocarditis. Usually they've had some sort of viral infection. And it does occur actually more often after COVID-19 than it does after getting the COVID-19 vaccine. It's a rare serious adverse event after COVID-19 vaccines, mostly in males, very rarely in females, and mostly in males in the 12 to 29 year age category. The rate in this group is about 1 in 10 to 1 in 20,000. So you can say, well, there was only 3,000 kids in the study. And if it's something that's so rare, it's 1 to 10 to 20,000, you're not going to see it, and you're right. It is something that is rare enough that we probably wouldn't see it in a study of the size of 3,000. So that's why we can't say it won't occur. We can say it may occur, but it seems to be very rare in other age categories. However, we do have some information that suggests that it likely won't occur very often. So first of all, no cases seen in the clinical trials. There were 3,000 vaccinated, all with at least 7 days follow-up. In the earlier studies that have shown myocarditis can occur in adolescents, they usually occur, adolescents and young adults, it usually occurs in the first few days after vaccination. So 7 days is long enough to follow kids. The other thing is that you may have heard the vaccine that's given to kids 5 to 11 years old, the company did some studies and they looked and they found that kids respond to a lower dose of vaccine. Kids' immune systems are more robust. They respond more strongly. And so kids don't need a 30 microgram dose. They can get by with a third of that dose. So this is a lower dose than what's given in those adolescents and adults who've gotten myocarditis. The other thing that we know is that viral myocarditis, the kind that's from the virus, not from vaccines, typically occurs more in older kids, in 12 to 17 or even older than that, than in 5 to 11-year-olds. So we aren't expecting that myocarditis is going to be a big issue in 5 to 11-year-olds, but it's not possible to say it's impossible. I just want to be direct about that. So what you have to do when you're thinking about any medication or any vaccine, and I think about this every time I write a prescription for a medication, is are the benefits of that medication outweighing the potential risks to the child? So what we have is the benefits, the prevention of COVID-19, prevention of hospitalizations, prevention of that multi-system inflammatory syndrome in children, death and long COVID, and possible prevention of transmission. We know that there is some prevention of transmission, and then safer return to school and social interactions. We want our kids to be able to get back to their lives. The risks, we know there's those mild side effects. Dr. Posa can talk a little bit about what's been seen in the kids that she's been vaccinating, and then that possible risk of myocarditis. Now, we haven't seen it yet, but we can't say it can't occur. It's possible that it may occur, but it seems to be a very, very rare side effect. And especially we expect that will be even more rare in this 5 to 11 year age category. So now I'm going to turn it over to Dr. Posa. She is a pediatrician, has been seeing a lot of families and talking to them, and she's put together some of the more commonly asked questions that families have talked to her about.
Hi, everybody. I'm Dr. Molly Posa. Thank you so much for joining us. I work at our Tioga clinic here at UF Health and have seen and taken care of lots of families and have heard lots of different questions, which are all wonderful questions because it's hard. It's hard to be a parent right now. It's hard to, feel like, am I making the right decision for myself and my family? And so I just wanted to answer some of those questions I've been hearing with the science behind those answers. So the first question is, does it work? Because if it doesn't work, why would we be giving it? So yes, it does work. COVID-19 vaccines are highly effective against severe disease, hospitalizations, and death. And that's really what we're trying to prevent, both for the child that receives the vaccine and hopefully decreasing transmission to caregivers. We know that vaccinated individuals are much less likely to be infected, but if they are infected, vaccinated individuals shed that virus for shorter periods of time. And if they're shedding it for shorter periods of time, that means we're going to decrease that transmission risk to others. So especially the caregivers or other children that are in the home. Another question I've been hearing quite a bit is, is it better for my child to get the disease? Do I want that natural immunity that they're going to get through COVID-19 disease, or should we get the vaccine? Or if my child has had COVID before, should they or should they not get the vaccine? So no, we know that COVID-19 is frequently asymptomatic or mild in children, but there are hospitalizations, long-term complications, and deaths that do occur in pediatric patients. We also don't know how long does that natural immunity last. So if your child gets COVID-19 disease, how long is the immunity they build going to protect them? Is it going to protect them from getting COVID-19 again if they're exposed to it again in school or by someone else? Studies have also shown that the immunity occurring after vaccination actually appears to be more protective. So it does a better job at building your immune system, and the immunity after vaccination is better than if you've gotten COVID-19 disease itself. So even if your child has gotten COVID-19 or yourself has gotten COVID-19 disease, you still want to get vaccinated. And then pediatric COVID-19 vaccination helps prevent spread in schools, group activities, and decreases community spread, which is really what our goal is. Another question I've been hearing quite a bit is, can the vaccine change my DNA? I think a lot of people are worried because they hear mRNA and they think, oh, this is part of your body. This is part of who you are, but it doesn't. mRNA vaccines do not change your DNA. They don't go into the nucleus, which is where your DNA in your body is located. And as Dr. Rasmussen had mentioned earlier, everything that's in the COVID-19 vaccine is actually out of your body within about 4 days. And part of it's out of it there even before then. So the mRNA in the vaccines are really that instruction to tell our cells to make a piece of that spike protein. That spike then migrates out of the cell. And like she had mentioned before, that's how our immune system can then recognize if you come in contact with COVID-19 again and can build that immunity and then fight COVID-19 disease if you've been vaccinated. Another question is, it really feels like, did this vaccine happen too quickly? 18, 20 months ago, we started to see COVID-19 in the US, and now we already have a vaccine for 5 to 11-year-olds. So was this too fast? Has there been enough testing? Has this gone through all the normal channels that all the other previous vaccines have gone through? And it has. COVID-19 vaccines have gone through a full randomized controlled clinical trials and all the typical FDA and CDC review processes. So nothing has been skipped. How did this happen? So billions of dollars in government funds have made this possible to happen and have all that testing performed. And really, mRNA vaccine technology has been around for a long period of time, but it's been studied for smaller diseases that maybe haven't had as much media news, like Zika virus. And so it did go through, the normal FDA process, went through phase 1, 2, and 3 of clinical trials. And even though 3,000 children doesn't seem like a whole lot, that's kind of a normal phase 3 number. So it's not that that is a dramatically lower number than we would expect for any other medication or immunization. So can you get COVID-19 disease from COVID-19 vaccine? So we hear this a lot also for the flu vaccine. In the past, I've gotten the flu vaccine and now I've gotten the flu. And that's probably just your immune system doing what it should be doing and kind of building that immune response, which sometimes you feel achy and tired and might get a low-grade fever, but that's normal. So no, none of the COVID-19 vaccines that are authorized for use in the US contain any live virus. So it is not possible to get COVID-19 disease after getting COVID-19 vaccine. So initially, and especially with adults, when we were first starting it, we were saying you shouldn't get another vaccine within 2 weeks of getting your COVID vaccine. And so can your child receive other vaccines within 2 weeks of the COVID vaccination? And yes, so initially, those initial recommendations were precautionary. We didn't quite know how your body's immune system was going to react if you'd gotten the COVID-19 vaccine and then you were getting another vaccine. We know that it is just fine to do both. And so your child can receive their COVID-19 vaccine and any other needed vaccinations on the same day. So flu vaccine, very important to get your seasonal flu vaccine. So those two can be done on the same day without any increase or worry about complications. I think this is a really big kind of hot topic right now. A lot of stuff is on the internet right now about infertility and reproductive health. Parents are worried what's going to happen in the future. Is my child going to have infertility issues? And so there's no evidence that any vaccine, including COVID-19 vaccine, causes any issues with fertility. In the clinical trials, there were no difference in the number of pregnancies between vaccinated women and the placebo group. So there was no decrease in death rate and no increase in miscarriages after COVID-19 vaccine. And we know that women who are pregnant and get COVID-19 are at significantly increased risk for hospitalization and death. And so it's really important that those individuals also get vaccinated. So in summary, this pandemic, unfortunately, it's not over. We're still continuing to have high levels of spread of virus in the United States. As Dr. Rasmussen had mentioned, new variants are continuing to emerge, including Omicron, and we have lots of unanswered questions about Omicron. What is it going to entail? When is it going to get to the US if it isn't already here? And so we really need to continue to use proven methods to protect ourselves and our children, and that includes vaccination for our children and then booster vaccines for people who are 18 and older. And so all the studies have shown that COVID-19 vaccines are safe and effective in children 5 to 11 years of age. And so where can I get my child vaccinated? Hopefully some of your questions were answered, and we'll continue to answer some individual questions, but where can I get my child vaccinated? So talking to your child's pediatrician, a lot of private practices and academic locations are vaccinated in their clinics, or going to vaccines.gov where you can find local places that are offering vaccine close to you. If you're currently in Gainesville, all of the UF Health pediatric clinics are offering it. We offer it both for parents and for children. So we have lots of families that are coming in and getting it together. Private pharmacies are doing it, CVS, Walgreens, Target, lots of grocery stores. And then if you live in Alachua County and your child goes to school here, they will soon be offering vaccination in the Alachua County public schools. Really important to remember that COVID-19 vaccines are free for everybody, and you can get your COVID-19 and flu vaccine on the same day. I also want to talk just a little bit about what I've been seeing in my own clinic and kind of side effects, because I think parents worry about side effects, and maybe some of us as adults have had some pretty significant side effects, especially after their second vaccination. And while we have been seeing some arm soreness and muscle aches and fever, a majority of children don't have that, and they are up and moving and playing just like they normally would right after their vaccine. I have a 5 and a 7-year-old, and they both got their vaccinations about 20 minutes after we got it in clinic, and you would never have known they had gotten their vaccine because they were up and moving and playing like crazy. And so I think it's important that if you have any questions that you talk with your child's pediatrician, because they're really a trusted individual for you and can answer any like specific question that you might have or worry or concern that you may have for your child. And just as a reminder, COVID-19 is a new disease caused by a new virus, first recognized in December of 2019. And this knowledge is rapidly changing, just like we're seeing with Omicron right now. So what starts the day might not end the day in the knowledge that we know. We learn new things every day. So for the most up-to-date information, you can go to www.cdc.gov. And then any questions we'll answer now, but also if you have any questions that you would just like to individually ask, both Dr. Rasmussen's and my email addresses are available up on the screen right now. I did see one question here that I was going to answer about a parent whose child just turned 5 a few weeks ago with a history of a congenital heart disease and wondering, is it okay? Are there any increased risks for their child for getting the COVID-19 vaccine? Are there any risks or increased risks in there? In the children that were studied, there were children that had congenital heart disease in that group, and there were not any increased risks or side effects of those children. Here at the University of Florida, our cardiac clinic is definitely recommending all patients with congenital heart disease to get their vaccine as soon as possible, because we do know that children who have congenital heart disease, obesity, neurological disorders, asthma, if they do get COVID-19 vaccine itself, their risk of complications and death is statistically significantly higher than a child who does not have those.
So if they get COVID-19,
if they get the disease, sorry, yes, if they get COVID-19 disease, their risk of hospitalization and death is significantly higher than a child without any underlying medical conditions.
Okay, great. Thanks for answering that one. Do you think that there'll be any issues for a child who had severe ADHD getting the vaccine? You seen any information about that?
I have not. I've vaccinated lots of children with ADHD over these past few weeks and haven't seen any increased, concerns or worries from those parents. I would recommend maybe if your child does have ADHD and feels more comfortable at your pediatrician's office and feels maybe safer there, that they get it done there, just because they will know your child a little bit better. But obviously you can get it done anywhere. But sometimes that our children that are a little bit more nervous, if they go and see a face they know, they feel a little bit more comfortable.
Okay, great. Do either of you have any information? And I hope we received a question in Spanish, and I hope I'm translating it correctly. But anybody have any idea about how many kids in the 5 to 11 year range have been vaccinated so far?
About, well, this is about a week ago, it was about 10%. So my guess that, last time I looked was about a week ago and it was about 10%. I'm not sure how many more have gotten vaccinated since everybody was focused on Thanksgiving dinner this last week, but about a week ago, it was about 10%. So really a rapid increase in the number of kids getting vaccinated during that time period. So we're seeing a lot of families wanting to get the vaccine so that their kids are protected as possible by the Christmas time holiday. So.
Okay. We received this question in advance, but, and I know you covered it a little bit, but is it true that children who are fairly healthy will only need one dose of the vaccine?
No, the data really show that kids, like adults, are going to need 2 doses. To get the full protection that we want people to have, you need both doses of the vaccine.
Okay. We received another question that says, my son is 11. He has started puberty and also has autism. Were the vaccine clinical trial data analyzed for effects on children with autism?
Yeah, they didn't break it down with autism, but there was a category of neurologic disorders, and there weren't any significant adverse events seen in those categories. So how many kids were in that category that had autism? I would guess some kids had autism in that group, but we don't know. They didn't break it down further, but there weren't any particular conditions noticed. As common as autism is, I'm pretty sure that there were some kids with autism in the clinical trial that maybe weren't even pulled out specifically. So autism is so common.
Let's see, another question. So someone's concerned about myocarditis, and they said comparing myocarditis from the vaccine, the possibility of getting it from getting the vaccine to getting COVID, which is safer, which is a greater risk, really. I'm concerned about this very small number of children in clinical trials because my son has autism as well. Should I wait for a little bit more data, or do you recommend getting vaccinated now, even though there's a small risk for myocarditis?
Yeah, I think it's really important to realize that the risk of myocarditis from getting COVID-19 is higher, significantly higher. So the data that have been shown, there was a study in Israel that showed that the rates of getting myocarditis from COVID-19 was much higher than getting it from the vaccine. The other thing is that, and I should have mentioned this in my part of the talk, but seems like a different kind of myocarditis that's happening after the vaccine. It seems to be very mild. So when you get a virus-associated myocarditis, it can be really severe. Kids can land in the intensive care unit. They can be sick for a while. That's not the kind of thing that we've been seeing after the vaccine. It's been relatively mild. Dr. Posa told the story earlier when we were talking before the meeting started about a child that they thought had it, and then he never even went to the doctor and he did fine. So, so he never went to the cardiologist, never went to the specialist, never made it to the specialist and did fine. So I think what we're seeing is the vaccine-associated myocarditis is appearing to be very mild compared to the kind that we see related to the virus. So not only is it more common after getting COVID-19, but it's more severe after getting COVID-19 compared to if you get a vaccine.
Thank you for clarifying, because I don't think I listened to a lot of these talks, and I don't think ever once had I heard that say that you're more likely to get it from getting COVID than you would, because you hear a lot of talk about it. So I think that's very helpful. Dr. Posa, did I interrupt you? Did you have something you wanted to add?
No, I was just going to, reiterate that typically if you get myocarditis after vaccination, it's self-limited, meaning that it resolves by itself, and most children did not require hospitalization or any other long-term care, which is not true of if they've gotten myocarditis from the disease itself.
Okay. Perfect. Let's see, another question. When do you think the vaccine might be available for younger children? For children younger than 5?
That's a really hard question. And there's a lot of the experts are speculating about that right now. And I think most people think it's going to be a ways into 2022. So the studies are ongoing. I've seen some of my pediatrician friends in other areas that are signing their kids up for the studies because they want their kid to at least have the chance of getting the vaccine. But they're just at the early phases of signing people up. it's going to be a while before I think we're going to have the results. Of course, we're all wanting those kids to be protected, but I also want them to do the studies so they can be sure kids are safe. I want them to take the time they need to do the studies right. So my guess is probably, hopefully early spring. I think I was like a couple weeks, I thought it was going to be a little bit earlier for the 5 to 11-year-olds. I was pretty close for my guess on that. I was hoping by Halloween, and I think it was a few days after that. But my guess is going to be early spring or late winter. I don't know, Dr. Posa, do you have
that's what I've been. Yeah, spring or summer is what it's seeming like it's going to be for that, 6 months to 4 years of age.
Okay. Someone had a question that's really just kind of about COVID testing in general, but do they test each individual sample to see what variant it is?
They don't. So it's something that is done. They do a sample. So they do not every sample that comes in, but they do a certain number out of every ones that are coming in. They tend to do ones that seem to be unusual. If somebody has more of a severe disease, sometimes they'll be more likely to sequence the variant. Sequencing is a lot of work. So you don't want to do that on every case, or it would be really expensive to get your testing done. So they do it on a certain number of cases, and then they do it, for example, if there's a vaccine breakthrough infection, they might be more likely to do it because they want to see why did this person get the infection even though they were vaccinated. So it's not being done on everybody right now. Right now, it doesn't really, well, a week ago, it didn't really matter because almost everything was Delta. Almost every case that was tested was Delta. Now we really need to have more sequencing done because we need to be able to see whether Omicron is out there. There isn't as much testing is done as we need to be able to pick it up right now.
Okay. Here's another question. Someone says, I know being a doctor at this time is hard, so thank you both for your work and your dedication. My question to you both is that, what can I say to family members who refuse vaccination and actively advocate against vaccination? I want them and their children to be safe, but it's so hard to change their minds. I know, Dr. Posa, we talked earlier, and how you talked to a lot of families. Can you give some advice on that?
This is such a hard one. It really is. So I've started to come from a place of, what are your concerns? So not coming in with, you've got to do this, because nobody wants to hear you have to do this or be forced into anything, but really listening to and understanding where their concerns come from. This is something that, a vaccine that's been around for not a super long period of time. Yes, it went through all of the clinical trials that it should be and all the regulations, but I still think people have worries. So, what are their concerns? Because a lot of times it's a specific concern or two, and then going from there. So, okay, you're worried about infertility. Well, let's look through the trials. Let's, have you talk with your child's pediatrician? Have you somebody that's trusted to them? I feel like that information coming from them, they're a little bit more likely to hear and be a little bit more receptive to. But it is difficult. And I think talking about it frequently is a good thing. And then not pushing, but gently, talking about how, you're coming from a place of wanting them to be safe and wanting your family to be safe too, because if you're around them, even if you've been vaccinated, unfortunately, there are, cases of people who are vaccinated getting the disease too.
Yeah, I agree. It's really hard. And I think what I try to remind myself is that there are people out there right now that are actively trying to share misinformation. They're trying to share false information. And I think people sometimes don't know where to get accurate information from. They see something on social media and they say, well, maybe this is true. I'm scared enough that I'm cautious about the vaccine now. So I think exactly what Dr. Posa says, trying to understand, where did they hear this? Was it from a valid source? And if they still have questions about that, to talk to someone that they trust. I do feel like people are going to be more likely. I know when I give talks about the vaccination during pregnancy, people trust their OBGYN. When it's kids, people trust their pediatrician. And I think that's the best place to send people with real questions. You can do your best, but I think sometimes it's just really hard. So trying to be understanding though, understanding that people just are scared. It's not that they're wrong or bad, it's just they're scared. So
I've
Yeah,
had lots of adolescents share like TikTok concerns that they've seen, and then we've talked about those, and I'm like, well, I've been vaccinated for over a year now and I'm still standing and everything's fine, and my 2 children have been vaccinated, and I just feel like that trust there with your pediatrician is really important.
Yeah, that's good. Yeah. I think that, we've done a number of these webinars, and so I've helped research a lot of information with a person who'll come with a question, a very specific question. And the CDC has a really, or coronavirus.gov as well, have a really good, almost like you can type in your thing, am I going to become magnetic? And then they have really simple answers, and then they'll link to other things as well. But some of them are just, no, you're not going to become magnetic. There is nothing in that ingredient, and so they have a really good way that's quick and easy to search for some of those really specific questions. And then I know we did, Dr. Rasmussen and I and a few other physicians did a great webinar really designed at women and fertility issues and breastfeeding and pregnancy issues. We did it, gosh, it feels like forever now, but it was probably just, 6 months ago or so. And if anyone's interested in watching that, it's ufhealth.org/wellness, and you can find a link to that video. And it was probably one of the most popular ones that we've done around COVID, because there's so many questions that a woman might have because, of their childbearing age or pregnant or breastfeeding, and a lot of great information there. So I don't have any more questions that have come in. I would like to thank everyone for joining us tonight. I'd like to share that I'm vaccinated too. I've had my vaccine for almost a year, and my entire family as well. So I encourage everyone to get vaccinated if they can. If you have questions, again, you can email those questions to me, or their email addresses were shared, and I'll get that. You're going to get a follow-up link to this recording, and I'd be happy to help get those answers for you if we can.
great. Thank you so much. Thanks for all of you for attending.
Thank you.